How do you approach explaining the safety aspect of ILIT? Compared, if you're explaining this compared to maybe SCIT.
So I talk a lot about mast cells since I see a lot of people with some pretty irritable mast cells, taking care of a lot of people with mast cell activation. Mast cells on the whole are primarily found in our connective tissue, and there are very few to none found within our lymph nodes. Mast cells are the cells that are primarily responsible for causing those whole body allergic reactions, so those anaphylactic reactions. And so when we are directing this allergen directly into a space that has fewer mast cells than the place we normally would put it, that's one advantage. Now, certainly you are going through the skin, you're going through a little connective tissue on your way to the lymph node, but we, do our best to prevent any kind of leakage of that allergen out of the syringe. And the other aspect is we're actually using a smaller amount of allergen compared to what we would put in that connective tissue directly with those mast cells. And so when I think of it for especially my patient population, who on the whole, I tend to see some very sensitive folks who kind of are the canary in the coal mine individuals. And in my mind, I feel so much safer, more controlled. We only have those 3 visits that we have to worry about compared to dozens, if not hundreds. And gosh, those are 2 really huge advantages.
That's another thing I tell patients too, is if I have a lot of patients who will say, well, I tried allergy shots, but I couldn't tolerate it because I kept having these large local reactions. Or, and honest, another example would be people who are scared of needles. And I'll say, well, the advantage of ILIT is you can have a large local reaction in the area. It's a lot less common, but this would happen 3 times instead of 100 or more times over the course of the next 5 years. And so doing that is much easier whenever you're just going to do it 3 times.
Yeah. And I'm not a statistician by any means, but when you think about the cumulative risk for the number of injections over time, you're reducing that significantly.
Absolutely.
Definitely.
Yeah.